I hope all of you are doing well. Okay, so quite a few participants have joined in. So let's just start today's session. So today we are starting with our next station. Till now, I guess all of you have gone through all the history classes, and some things are going to be similar to what we have learned in history station. But communication station, I would say it is the most important, and personally for me, it is one of the most difficult stations that I personally feel needs a lot of practice and a lot of attention because in all the other stations, there's usually some repetition that keeps going on. But in the communication station, there's obviously there are some repetitions, but there's always something new that comes up, and like you get upset on that. So this is one station in which I always suggest whoever asks me how to prepare, I always tell them that you have to do the communication station daily. Whenever, no matter that you're starting 6 months earlier to your exams or 3 months prior to your exam, whenever you're starting your preparation, make a routine to do one or two communication stations daily. You can either practice them, or if even if you're not practicing, just go through those and see whatever guidelines would fit into that and make something in your mind. Because communication is something that I feel some people are naturally good at it. It really depends on the place you're working at, because though like those of you who are working in the setups maybe in UK or in some other countries where the communication is given a lot of importance, or like it's given a lot of attention, then in those like if you're practicing in one of those stations or one of those countries, then your communication would be smoother, easier. But for a lot of candidates, like personally those who are here in Pakistan, maybe in India as well, because of the language differences, we communicate in different language. So when we start communications in English, it takes some effort, it takes some extra energy, some extra practice to become fluent in communication station and go through it without any difficulty. So we are here to guide you. We are here to correct you at all points of time. Anytime that you feel that you have any confusion, you have any questions, just keep sending them in the group or here during the presentation as well. The format of the communication stations that we have made is that they will be doing the introduction. First an hour or so will be about the introduction, because a good base about good knowledge about the station, how it works, how to score marks. That's really important. Then in today's and in the next session, we are going to cover the scenarios of information giving. So basically, as we go through, you'll get to know that communication station is like there are multiple types of scenarios that can come in. Obviously, some of you all have already gone through the text, so the recalls, you have an idea about the exam. Those of you who are just new and have not do not have much of the knowledge, this is going to be really helpful for you. So the next classes that we have divided is about the different types of scenarios. No matter The thing is that no matter how many classes do we take, we cannot ever tell you that we have covered every possible communication, because there's millions of topics that can come to you in the communication. Definitely what we focus is that we're going to take the recalls, we're going to take the scenarios that have been coming in the recent past, and we're going to practice them. Other than that, we're going to tell them how to do a journal communication station which is having a similar like this information giving. We're going to tell you how to do that. So we're going to practice that in the different classes, right? Other than that, whenever you are doing practice by yourself and you feel like that there are questions when you with scenarios in which you're not understanding that how to proceed, how to answer any specific question, how to deal with any query, anything, you can always obviously ask us, right? So okay, let's just start. So the outline of today's this presentation would be the format of communication station, like what exactly happens in the communication station, how to approach a communication station, types of communication, pitfalls to avoid, and how to improve yourselves. We're going to discuss all of these. Okay. Communication, you are going to have two communication station in your clinical exam. Each of the station would be of 9 minutes. So I've taken this from the RCPCH website. So in there, like the text that they've given. So the aim of the communication which is written is that the aim of communication station is to test the candidate's ability to communicate appropriate, factually correct information in an effective manner within the context of the clinical settings. So you see, it's about your communication, it's about the factually correct information that you're giving, and how the clinical setting is like. Is it like in an ER setting? How you have an idea that where what to speak at what point of time. The two stations are based on centrally written and benchmark scenarios. The communication station involves a role player. The role player may take on the role of the parent, an adolescent, a health professional, or a member of public. Candidates might be asked to act out a telephone conversation, a video consultation, or face-to-face encounter. So usually this telephone conversation and video consultation, this does not happen now. It is basically a face-to-face encounter. And yes, the role play that you have it can be a parent, it can be an adolescent, and it can be a student, it can be a nurse, it can be some worker as well, right? So it can be different kind of scenarios. One thing that you have to keep in mind is the role players are really, really good, right? They are not the real-time parents, or they're not the real teenagers. They are the role players who have been practiced, who are practicing for the scenario for quite some time. They act really, really well, right? So you wouldn't expect how good the role play would be. Like they would start crying, they would start hiccuping, they would be really, really sad. At times the parents, they get really angry. So you have to manage their concerns. It's just like a real scenario, that in fact more than a real scenario, a bit of an exaggerated one as well. Okay. So, what there are six main patterns of communication scenario. Information giving. Information giving means that please tell this teenager about the diagnosis. Uh, let's just see, there's information giving and there's breaking bad news. Explain the results of ultrasound and its implications. So, information giving and breaking bad news, they look like more of a similar kind of a scenario in which there have been some tests that have been done, or there's a certain condition about which you have to tell about the parent. The difference comes about the severity of the condition, right? So in the breaking bad news, there would be something which would be a very serious kind of a thing. And when you break that news to the parents, they would be going to be really upset, sad. You have to give them some time, right? So it could be something